Okay, Mrs. Smith, so as you can see from the radiographs, the x-ray pictures that are up on the screen, you have some decay in some teeth. So you have a few options in what you want to do. Mrs. Smith. Option number 1. You can do nothing. The advantages of that are no treatment, no costs, but it's only going to get worse. Oh well, I don't only want to do nothing. If there's something going on, I want to do something about it. Sounds like a good idea, Mrs. Smith. The second option then is we do an NHS metal filling. So your shiny metal fillings like the ones that you have. Or we can do a composite, which is a white filling. Now, people think that the biggest difference is the colour, but they work completely differently, okay? These two come together, we'll come back to that in a second. The other option, number 4, is to do an onlay on the tooth. That's something that we make outside of the mouth and glue in place. But let's go back to these. Like I said, yes, people think that it's just the colour, but it isn't. Let me show you. They work completely differently, okay? So let me draw a tooth here. Imagine we're looking along it this way. Does that make sense? Yes, that makes sense. Great. A metal filling works like this, right? We drill a small hole at the top and a wider hole at the bottom. And then into that we pack in and squish in the metal filling, and then it sets. But it's not attached to the tooth. It's just that it can't fall out of here because of the shape. But it's not attached to the tooth. So it's okay when they're small, but once they start to get bigger, we start to have some problems. Because look, if I make this a big one now, here, you can see now that this little bit of tooth here and here is very, very thin. And because it's not attached, as you bite on these bits here, these bits of tooth flex backwards and forwards like this. They're moving back and forwards, and you get little crack lines forming here and here. And then over time, bits of the tooth break off. So it does the job for now, but in the long run, they break teeth. Option number 3 is to do a composite, a white filling. That's the biggest advantage for you, is that it looks nicer, but for me it works completely differently. All I have to do is just remove the decay, and then it's glued into the tooth. It's attached to the tooth, bonded into place, which means that in the long run you keep more tooth. Both of them last about the same amount of time, 5 to 7 years on average. However, when this one needs replaced with the composite, you have more tooth left at the end. An onlay is generally the best option, but because of that, carries the biggest investment. What we do is, you've got the shape of the hole, we make the filling outside of the tooth, and it gets then glued into place. So it's strong and the longest lasting. This one lasts about 10 to 12 years. So, your NHS metal filling, it's about £25. Your composite filling, it's about £200. And your onlay, it's about £725. So, Mrs. Smith, it's entirely up to you. What do you want to do? And if you're an early dentist, you're doing a lot of NHS work at the moment, most of the time you will now, I've changed my pen, be doing composites with some of these. But now this seed is planted for this. It's about planting the seeds. Because these patients, you want to be looking after them. You want to be looking after your flock for a while. So now you've planted that seed, so that when that fails, in 5 years' time, now you're doing these. Okay, hopefully that makes sense, and I'm really up for some discussion. Tell me how this is a lot of rubbish. This made me the highest grossing associate in the practice. Get yourself a whiteboard. You can get whiteboards for like a tenner off of Amazon, and it will just completely overhaul your working life, I'm telling you. It's this. Because what this is the honest to God's truth of what is going on with the fillings. This is what happens. This is what you see. And it's the simplest way to educate them on it. Right, I'm going to stop talking now because I'm going to end up in a rant. Right, bye.